Dr. Rapiti. It's Saturday, the 2nd of August 2025, and it's a long time I've been doing one of these videos, and this video in particular is very important because during COVID we treated a lot of patients, and in that time I saw about 4,000 patients, very few returned, so I was unable to assess the efficacy of my protocol. And the way you want assess the efficacy of one's protocol is basically to see how did the patient end up. Did they end up with complications? And in COVID, one of the complications would be a shortness of breath with a severe irreparable lung damage. I'm pleased to say I have here with me a patient whom I mentioned in several of my books. I'm currently writing my manuscript on the COVID story. And this particular patient is a very dear patient to me. I haven't seen her, I couldn't recognize her today. She's come back to me, I think it was in 2021, it's now 2025. It's 4 years on that she's come back. She had a history of coming to me, brought in by 4 burly men, because she could barely walk. She had an oxygen of 45%. She was probably very confused at the time. And I remember asking her distinctly if she wanted to go to hospital. She nodded her head in disapproval and wanted me to treat her. I treated her with my protocol and she did extremely well. Within 2 weeks she did well. She's here back with me, bringing her son for a chest problem. And I was quite amazed. I couldn't recognize her. But what I'm pleased to see is that she's got absolutely no side effects. To validate my own theory about the way I treated people, and that is correct, I have the patient here with me to give her testimony of how she's feeling, whether she had side effects. And I'm very pleased to say that the methods that we used were perfectly correct. The type of protocol that should have been followed. I have not had a single case of long COVID or complications. So what they talk about in America is completely rare in this country or in my practice. But yet to tell us our own story is a patient herself. Ma'am, tell us how you came when you came to see us at the time.
Okay, so I came and I was diagnosed with COVID at the day hospital. And then somebody referred me to come to Dr. Rapiti because then I became worse. So I collapsed. And then the following day, they brought me through. I couldn't walk in. I was pushed in with a wheelie chair. And I was completely out of breath. And Dr. Rapiti gave me treatment. And I'm much, much, much better 4 years later.
Right. Do you have any complications of?
No, no complications.
Can you recall what was your oxygen level at the time?
Oxygen level at the time was 45%.
Okay. Well, yeah, folks, there you have it, 45%, and she didn't go to hospital, didn't get any of that terrible ventilation that all our patients got for 90% oxygen and never survived. Yes, patient 45% put on my protocol and home oxygen, and 4 years down the line, she hasn't got a trace of her COVID. So, well, I hope this inspires you, enlightens you, and clears any doubts of those doubting Thomases who thought my protocol was from Mars. Take care, have a good day, and watch out for my manuscript and my book that's about to come out. The title is Courage Against the Consensus by One Single Person. Thank you, Dr. Rapiti.